pain in my stomach like 2-3 days back. But whoever hasn't got it will not realize it, and even if I explain how painful it is, you're not going to understand how painful it is. It is really bad. I told them that this is the issue. I couldn't just even talk. Like, they were asking me questions and I was like blanking out in between. I didn't even know what to tell them. This is how it works in Canada, okay? Even if it's really critical, they'll ask you to wait until they can place you with a doctor. Vlogs. So I wasn't expecting to do a video today, but then I thought I should just come on the video and tell you guys about some things. I'm not in the best of my health to actually make this video, but I was actually asked by my landlord to just come out for an hour because he wanted to do some pest control thing inside the house. So I'm just sitting outside my house in my car, and meanwhile I thought I'll do the video for you guys. So why I told you I'm not in my best of my health is because I had some pain in my stomach like 2-3 days back. Actually, it started with a back pain, and then I took 1 day leave from office. I thought I have a slip disc issue, so I thought it's that pain, and I was telling Prashant also, okay, let me have my muscle relaxants and then get back to normal so that next day I can get back to work, because we cannot take a lot of leave at work, unlike companies in India. It's not that for you get paid per day. So if I miss 1 day of work, that means my 1 day of pay is gone. So I didn't want to actually miss work, but then I had to take 1 day of leave, and then I got back to office the next day. So this was on I think Thursday. I went back to office, or Wednesday, I don't remember. So got back to office thinking, okay, everything is fine. The back pain was still there, but then I'm like, okay, let me at least go and start off with work, because I'm actually learning a new job. So I wanted to make sure that I don't take a gap and then not learn it properly. So I went in the morning, and then after around half an hour, 45 minutes, I kind of realized it's not just my slip disc back pain, it is something else. So 2 to 3 years back, I had kidney stones, right? So that was back in, I think, 2020 when I went to India. When I went from Bangalore to Trivandrum, that's when I got my kidney stone for the first time. And that pain was unbearable. Whoever has got kidney stone will understand what I'm talking about. Whoever hasn't got it will not realize it. And even if I explain how painful it is, you're not going to understand how painful it is. It is really bad. I kind of got an idea it's a kidney stone pain because there's a type of pain that's there. Your back and your stomach pains together in one point. I really don't know how to explain. So that's the kind of pain I started getting when I was in office, and then I kind of understood. Actually, the previous night also I was feeling very I was having nausea, in the sense I was feeling pukish, and I was not able to eat food properly the previous night. And also I was wondering, okay, what is wrong? Maybe it's just some kind of food poisoning or something. But the next day also I went to office, and then I was feeling very pukish. I was sweating, and I was having severe stomach pain. All of a sudden, it's like as if somebody's put a clip on your stomach and your back. It's like that. All these kind of things, and I was dreading it because when I came from India, actually I got some medication and came thinking, okay, if I get it at all, I can survive for some until I get my health card. But then I actually didn't want to get it after that, because obviously most of you know how the health system in Canada is or in Saskatchewan. So today I'm going to discuss about my experience of experiencing the health system in Canada. So I came back after that. I got some painkillers from my friend. So I got that, came back home thinking, okay, I'll have the painkiller, sleep off, and everything is going to be fine. But I had the painkiller, and after like 10-15 minutes, I was continuously vomiting. And whoever has this kind of kidney issues will understand that, once it's not that you have. I mean, it's that you're vomiting. It's just that, the feeling, you would constantly want to go to the washroom, and, that feeling is like weird. And then my whole body was getting strained. I couldn't lie down, I couldn't sit, I couldn't do anything. And Prashant is in office. Obviously, both of us are working. Unlike in India, we don't have a support system here, and it's really difficult, in that case. And then I just decided, I'm a person who does not eat medicines, and I'm a person who does not visit doctors, because I don't know, I feel only when it's really urgent or needed is when you need to have medicines or visit a doctor. So I was like thinking, okay, let me just try with this painkiller, maybe it will go off. But then it got to a point wherein I just called my husband and told, I'm going to the emergency, I cannot sit at home. So that's when he realized how bad it is, because he knew that I was in pain. But when I'm telling somebody that I need to go to the emergency or meet a doctor, it'll be that bad. So I couldn't even drive. My hands and my legs were shivering because I was vomiting and I was dehydrated. Whatever I had, breakfast or something in the morning, I puked that also out. So then I had absolutely nothing in my system. Thankfully, the hospital is just, on the other side of the road where I'm staying. So I drove, parked the car there, went and told them about this issue. And then they started looking at my health card, which expired, and I've actually given it for renewal. I gave it like 2 months back, but the health card still hasn't come. So I told them this is the issue. I still don't know whether I'll get a bill for it or not, but then I told them that this is the issue. I couldn't just even talk. They were asking me questions, and I was like blanking out in between. I didn't even know what to tell them. And in between the conversation, I'm telling, just give me a minute. And then I'm running to the washroom there, and I'm puking there. Then I'm coming back and giving back the rest of the information. After all this, they told me, you just need to wait. We'll call you when the doctor is available. So if you are in an emergency in Canada for any medical stuff, just go to the emergency, like go into the emergency ward and then get yourself admitted, rather than, going to a walk-in clinic. In this video, I'll be talking about my experience, and also how the health system works in Canada. So finally, I told my husband also to come to the hospital, because obviously, if I'm getting admitted, I will need a bystander. And then in like 1 hour or something, 1 or 2 hours, he also reached the hospital. And then I really didn't know what was happening, because as soon as I entered, they gave me a medicine saying that, okay, this will reduce your vomiting. But even after having that, I was puking continuously, and then I was sitting on the chair. This is how it works in Canada, okay? Even if it's really, really critical, they'll ask you to wait until they can place you with a doctor, until and unless you call 911. So if you're in a really dying situation where you have like some breathing issue, or you're choking or things like that, or where the person is not responding and all, you can call 911 and they will come and take you in an ambulance, and obviously you'll get immediate response. And I know one of my friend whose husband went through this, and then she got immediate attention, and then she told things went smooth after that. But in my case, it was not like a situation where I'm dying, so I had to wait until the time I felt I was dying. And then I was sitting there for almost 4 hours to get attended. I'm not saying it's a bad thing. Obviously, they're trying to look at patients who are in more urgency, than me. And then finally, they called. But after that, I'm telling you, it was really smooth, like they took me in, they asked me what the issue is. The doctors are extremely friendly. They asked what the issue is. Immediately, they started giving me IV, and then, started giving me medicines with it. When they asked about the pain itself, they understood there's something relating to the kidney. So then they started giving me medicines. Immediately took me for like CT scans, X-rays, blood tests, urine tests, and all these kind of things. And then I kind of blanked out after that, because they gave me like really strong medicines, and I was like feeling very dizzy, and I slept off, because I haven't slept the previous night also. And then so this I actually went to the emergency by 10 o'clock. I think we got to meet we got to meet the doctor by around maybe 1, and then the medication and everything started, and finally they came out with an outcome after 4-5 hours telling that it's not a kidney stone, it's a kidney infection, and that you need to take these medicines, these are the precautions you need to take. And then by night is when I got discharged. So this is my story. I'm not showcasing this as a bad event, okay? I'm just telling you my experience, what I went through. I'm not telling you, okay, Canada medical system is really bad, this is what happens, don't come to Canada because of this. I'm not telling you any of those things. I'm just I wanted to share this experience with you and get you guys also prepared for such things. So I know a lot of people who come to Canada thinking, okay, fine, healthcare is free out here. Yes, healthcare is free. I could just walk out of the hospital without paying anything. But since my health card is expired and it's under renewal process, I don't know what the process is going to be. Maybe they'll send me a bill and then, reimburse or whatever it is. But then there was absolutely no charges. Like I could just go show my health card, wait, and then whenever they call me in, everything was like smooth, fast. Every all the CT scan, this and all, everything was super fast. And then we are so used to the Indian or especially I'm used to the Indian medical system, where you go into the hospital and it's like that things happens, and then like that a bill also comes out, right? But in this case, there's no bill. Things were a little slow, but this was a process. So whoever is coming to Canada, please don't keep a high expectation of how the healthcare system is out here. Most of you might know, but I'm giving you my story or my experience. Obviously healthcare is free and it does comes with its own pros and cons. Pros being obviously it's a free treatment that you're getting. You can actually it's just that the medicines you need to pay. But if you have an employer who is providing you with an insurance, like my husband has a medical insurance, and due to which my medication for this I just spent around $6. So whatever the cost might be, they will actually cover it in the insurance. So even previously when something like this happened and we had to buy medicines, the medicines are actually in a subsidized rate because he has an insurance. So obviously the spouse is also covered. So all those people who are coming to Canada with some kind of illness or some kind of ailment, okay, please make sure that you bring in medication for the next 2 years, or you bring in, like, if it's like some emergency, like if you're having some kidney issues, or if you're having some breathing issues, asthma, or you have some situation which you cannot come out of, then carry medications with you. Obviously you can carry medication, you just need to bring your prescription, like from your doctor in India or from whichever place you're coming, saying that okay, this person needs these many medicines, and they're carrying it with you. As long as you have the prescription, it's fine. I had carried my medicine. I don't know whether things have changed now, but I had carried that. I think you can also request your friends or family members, whoever's coming to Canada, or your college mates and all, ask them also if they can bring. I wouldn't suggest that, because obviously a person is, if you ask me to bring medicines, or you ask me, you give me a package to bring, I would never take that package unless and until I know the person. Even if I know the person really well, I would say I will maybe buy the medicine and take it, so that I know what is in the package. Because you don't know, right? I wouldn't blindly trust anybody when I'm traveling, mainly because you don't know what they're going to give you in the package. It's not that they're going to like smuggle things, but it's just to be on the safer side, because you will get into trouble later on. So always, you can ask your known people if they can get stuff. So always bring enough medicines for yourself. If you're like diabetic, if you have like BP medicines, or you have issues with some other kind of ailments or something, always get like for 2 years, bring your medicines. Or even when you're buying your medicine, look at the expiry. If it's like till the next 2 years, you can use it, and those kind of things. Even get like regular medicines like your Panadol or Dolo and all those things, if you're used to that kind of medicines, okay? Because the only thing you'll get off the counter in here out here in drug stores is Tylenol or Advil, whatever you say, that's all they're going to prescribe. They're not going to give you anything more than that, okay? Unless and or else if you're getting meeting a doctor and they prescribe, that's a different thing. But if you're going to the counter and saying, oh, you're having this, they'll say, okay, have Advil. Okay, then you next day you go and tell them you have this, they'll say, okay, have Tylenol. That's all. That's all they're going to say. They're not going to give you any more medications than that. So if you're a person who is used to medicines, who is used to visiting the hospital, then as and when required, I know like in my family, it's my mother, my sister, or my relatives, I know people who are used to going to doctors in India. Because they might get a leg pain, they'll go to a doctor. They might have like a knee pain, they'll go to a doctor. They might cough, they'll go to a doctor. If you're that kind of a person, then Canada wouldn't be a suitable place for you, or else you need to change your mindset and then come to Canada, because medical system is really slow here, especially this kind of emergency situation where you need immediate attention. You might not get it immediately. It might take time, but then obviously with that you might need to tolerate the pain and those kind of things. Like I told before, this is not a negative thing that I'm talking about. I'm just talking about my experience. I might be okay with it, you might not be okay with it. So if you're a person who is not okay with such things, then be prepared when you're coming to Canada. So as soon as you come to Canada, you get your SIN number and all, immediately apply for your health card, because your health card will take at least 2 to 3 months for you to get the physical card. And until then you can go, but it's a little dicey, they might say that you need to pay and those kind of things. So also get a health insurance before you travel. I took a travel and health insurance. You can go to Policy Bazaar. That's where I went to get my insurance. This is not a paid promotion, but they have like several options. I had taken Royal Sundaram insurance, I think for 6 to 7 months after once I land, it was covered for 7 months. I wanted it because I'm a person with back pain and all those kind of things, right? So I wanted that kind of the insurance. I never used it. So as soon as you come, apply for your health card. Even if your health card is expiring, in my case it's expired in I think August end. I had already applied it then, but I still haven't got it. So that's the delay, that's how that's what you're not used to. Okay, it's not that it's not something bad, it's that you are not used to it. Like things in India, how it's so technically advanced, medically advanced and all this kind of things. You get immediate attention for everything, right? So you're so used to that. But when you come to a system like this, you're like, oh, why are they not attending to me? Oh, why are they not treating? Oh, why are they not giving me medicines? Oh, I cannot adjust to this. What is this shitty system of healthcare and those kind of things? That's not the case. This is the case here. Okay, even when you're saying you're in really bad pain, they might not even prescribe pain medications, because that's the system here. So I knew I might get the pain back, so I asked them, can you please prescribe a painkiller? So they told, this is what I'm going to suggest you, but this you can take only unless and until your pain is so bad and Advil and Tylenol is not working. Only then use this particular painkiller, which is quite strong, which they don't prescribe usually. So that's how things are, So this is not exactly about how the healthcare system works or the pros and cons and all those things. I just wanted to share my experience. So if you're coming to Canada, don't have high expectations of certain things. I'm also making a video soon about why are people leaving Canada. I hear a lot of my subscribers also who are planning to leave Canada, which is quite surprising to me, but then there might be reasons. So I'm going to list out like 5 to 10 reasons of why people are leaving Canada. I'm also having an interview with one of the person who's there in Moose Jaw, who actually rents out apartments or houses in Moose Jaw to students. He actually came up and told me that these are some of the issues that we are facing, and it would be really great if you can address these on one of your videos. So instead of me addressing it, I wanted to take his interview. So I'm also planning that. So as and when things happen, I'm giving you a live update. I've never done a video on health cards or health system here, but this is how it is. Once I experience only, I usually put up a video. And I'm not in the best of the health to come and take a video. My throat is already going dry. I've been vomiting since last 2 days, and this whole area is like hurting. But since I was actually forced out of the house because they're doing pest control, I thought might as well sit and do a video and upload it and let you know, guys, about the health system in Canada and what you can expect. It's not bad, it's not the worst, but yeah, there are things that can be improved. There are things that you might not be expecting. There are things that you are used to but you're not getting here, so that doesn't make it bad, right? But that's how it is. And overall, I wouldn't say it was a really bad experience. I only felt that the wait time, the 3 to 4 hours of wait time, was a little too much for me to tolerate because of the pain, because the pain was unbearable. I can't tell you guys how bad it is, like I have no comments. So yeah, that's it, guys. So I thought I'll do this video. I'll surely make more videos like those two topics that I was talking about. So I hope you are in the pink of your health, because health is wealth. Make sure you drink a lot of water, which the doctor told me, which I am not doing, and stay healthy. And I hope you're having a great time wherever you are.